your time.
Well, terrific. I'm really pleased to be here to talk with you. And unfortunately, I'm not in your location. I want to come up with a PowerPoint display and talk about all things CBD and give you an idea of what's going on with this particular topic. You know, you're probably already familiar with cannabidiol, but I want to take it to the next level, I hope, for you to really dig into the weeds about what this stuff does and what the potential is for it. I just want to verify you're seeing the slide presentation.
Yep.
All right. We'll go into presentation mode, and then I'm going to click on the next slide, and you can see that as well, right?
Mm-hmm.
Okay, so the main point here I want to get across is that cannabidiol is turning the entire medical profession on its head. Everything that we thought we knew about medical, how the body works, is really going to be revolutionized. And with an adaptogen such as CBD, it is going to cross all areas of conventional medicine. And because of its safety and its effectiveness and the minimal amount of dose, then it's likely to be incorporated into almost every phase. So you're going to be hearing more and more information. You're going to see a skyrocketing of clinical information that's coming out. Unfortunately, we're very far behind because of restrictions that we've had in any type of studies that have been done, restrictions by institutions, restrictions and confusions about regulations about CBD. But mark my words, this is going to be a changing, earth-shattering sort of event that's going to come across. Now, my background is rather unusual coming into the cannabis space because I started off as West Point, trained at the University of Miami and as an MD, family physician training. I actually delivered my own children. I spent 28 years in uniform and retired as a U.S. Army colonel in 1968. And so since then, I've been doing disease management. For the last 5 years, I've been working in the CBD space, not working with any THC during this time, because that's not available easily and it violates the law in many cases. There's also lots of confusion about it. So my concentration has been in the area of CBD. And during this time, I've probably treated well over 3,000 patients using CBD and guidance, giving them guidance about what to do. Now, I don't have a clinic, so my patient care is by telephone and is remotely done, and giving patients advice and recommendations and the product that they have been using. I've been trying to be as specific with the product as possible, and being fairly consistent with using Elixinol products and having a very high rate of success. Well, you know, so a conservative background and training, but when I was introduced to CBD, did the research, and I started using CBD as well as starting applying it in patients, I saw this dramatic transformation that was unequaled in all of my career in medicine. So even after 45 years in medicine, you know, seeing these kinds of changes was absolutely profound, and I definitely wanted to explore more. But there's a lot to explore with regard to cannabidiol. You know, this is a natural food oil that comes from cannabis, and it's really designed for healing. The way it works is in signaling the body to make healthy changes and to relieve symptoms. It doesn't require a drug level in order to do this. It's really the signaling property that's connecting up with receptors in the body. Any way you can get this into the body, it can be very, very effective. Now, I apologize. I needed to update this particular slide. I just came back from Japan where I was speaking to practitioners there, and I didn't make that correction. But it's a simple molecule, as you can see on the right. So it's not that complex. It's lipid by nature, and the difference between it and THC is just a singular molecular connection. I always want to make the distinction between marijuana and hemp. The plant is essentially the same, but what's happened is the politics has gotten in the way, and it's tried to define things in a very peculiar, non-scientific way. So now we're getting back to the science now, but still that there's that lingering misunderstanding of the difference between marijuana and hemp. So marijuana, essentially, when I talk about it, when we're discussing it, when your patients are considering it, is a high THC form of cannabis that has very low amounts of CBD. On the other hand, hemp, and we don't call it industrial hemp anymore, it's just plain hemp based on congressional statements that have been made in the regulations. And that's high CBD with low THC. And arbitrarily, the designation has been 0.3% THC. Interestingly, this is different for almost every other country of the world. Europe uses zero point 0.2, Japan uses zero point 0. So quite a bit of variation in what's happening with it. But the basic principle is that THC can make you high and causes impairment, whereas CBD improves the brain performance and does not cause any significant impairment in our function. I want to speak towards the endocannabinoid system because this is a parallel topic that we need to approach. You've got to realize that this is a recently discovered complex master control system for our body that is orchestrating about all of the fine tuning of all of our other systems. It, the and a really important point that I have to make is that the endocannabinoid system, it can become dysfunctional. And when it's dysfunctional, you actually have this correlation with a wide array of diseases. In fact, almost all of the diseases that we have been identified with some aberration in the endocannabinoid system, whether that's receptors or its ligands or some of the other molecules that are involved, such as enzymes and transport molecules. So we defined a clinical endocannabinoid system deficiency as CED, as Russo suggested way back in early 2000s. And we're just gathering more and more evidence for that. Now, what messes up the endocannabinoid system? Well, it's bad diets, drugs that are causing issues, toxins. Recently I was at a mental health conference, and the evidence is coming out that many of the psychotropic medications, the antidepressants, actually lead to uh, adverse effects on our brain over a period of time. Many of these substances were not designed for long-term care, and yet the adverse effects have been minimized, and they're commonly used in the psychiatry profession. But a new group is forming, the functional and integrative medicine group, that is recognizing these particular issues and looking towards other substances that can be used. Now, I really like the idea of let's look at a new system and restore the endocannabinoid system. So how do we do that? Well, actually, we've been doing that for years with things like massage, with chiropractic, with acupuncture, with good diets, with detoxification. Getting those poisons out of our system can restore and rebalance the endocannabinoid system so that it's working more functionally. But now I think we've got a new tool with the liberalization of the rules and regulations around cannabidiol and cannabis, that we can use CBD to regulate and upregulate the endocannabinoid system to help us restore this particular important and master control system. I just want to show you the first animal that actually had a complete endocannabinoid system, the hydra. So this was almost 500 million years ago. Plants developed, started working with cannabinoids back in 600 million years ago. And then animals developed it 100 million years later. And now all your animals actually contain an endocannabinoid system, with the exception of the insects. It's incomplete for a system in insects, but goes back a long, long way. And we've incorporated this system to its utmost potential in humans. Now, this system consists of a wide array of particular molecules, and I've outlined some of these chemicals that are involved, both the receptors on the left, and you have the transmitters in the middle, but you also have the enzymes that are in the center, and even transport molecules that are moving some of these lipids around and across membrane layers. You know, endocannabinoid receptors are located on every membrane of the body, not just the cell surfaces, not just the nerve cells. So I want you to get a global picture of where this endocannabinoid system exists, much broader than what we have been led to think about in terms of the two single CB1 and CB2 receptors. We even see endocannabinoid receptors on liposomes or endosomes. So those formations of lipid collections with a membrane, a phospholipid membrane inside the cell that transports molecules in and out of the cell and nutrients. Those contain endocannabinoid receptors. So this is a wide array of different molecules and connections within the body, which leads to our better understanding of why using phytocannabinoids can dramatically change our physiology and function. Now, we've got endocannabinoid deficiency that occurs. And I'll give you just one example in post-traumatic stress disorder, where you have an excess of CB2 receptors and low cannabinoids. And at the same time, you've got an increase in the endocannabinoid system enzymes that break down the endocannabinoids. So you have a minimized availability, while you also have an elevated formation of cytokines, those inflammatory substances from white blood cells. How does CBD work? Well, CBD actually binds to cell receptors, and of course we do have the endocannabinoid system, and we're talking about cannabinoids, but CBD goes well beyond the endocannabinoid system, and it binds to many different the cell receptors. So it's working in a broad area, but fortunately it is an adaptogenic. It's actually working for the benefit of the body to restore homeostasis in almost every situation that I've encountered, even some paradoxic situations that I hope to get to later. It reduces stress and fear, such as in PTSD. It reduces pain and inflammation. It regulates energy and metabolism right down to the mitochondrial level. It regulates neurotransmitters in the nerves, and that's what we hear about most frequently at this neurotransmitter level in the synapses between the axon and the dendrite, making that connection. But as I mentioned before, the endocannabinoid system is much more diverse, and so CBD is actually connecting up with many of those links, as well as other receptors that are in that system. CBD has been proven effective in epilepsy, no question about it. It's definitely there. So when people say, well, we don't know if it's effective, it is effective, but you were going to have to split hairs in terms of what physicians and researchers are defining as effective. And we can talk about some of that in the studies before. But the key point that I want to get to here is that CBD helps the endocannabinoid system to rebalance this system, which is really designed to maintain our homeostasis, not to make us extreme one way or the other way, just to give us to balance and restore health for the body. It works, their main function works as a key and a lock, making adjustments. But this is an extremely simplified view, because those locks or receptors actually have multiple different actions that can occur rather than just turning on or off. Here's a few of the receptors that are involved with CBD. And, you have this regulation that's going across the body. The PPAR receptors are particularly interesting because they are epigenetic. they're actually modifying the way that DNA is being expressed within the cells. The PPAR gamma receptors in particular are notable in macrophages and immune cells, and regulating the cytokines that coming from it. And you have, of course, the CB1 and CB2 receptors that are really well known in the synapses, but you have this wide array of other synapses that are located, and we're discovering more connections, and you'll see some of those connections and some of those receptor systems that CBD is connected to later on. Where does CBD work? So I've already talked about this endocannabinoid system being in all cell types, actually. So you're getting effects on the brain, on the immune system, on the hormone systems, the pituitary, adrenal axis. It's working on the intestinal system. And I know you're aware that our gastrointestinal tract actually has more neurotransmitters and more neurotransmitter receptors than our brain does. And so it's only natural that we have this particular, we've got benefits that can occur within the intestinal tract. Another area of interest is vascular. Where CBD is regulating some of these leaky membranes, whether it's on the intestinal side or it's in the blood vessels of the brain, in the eye, or almost anywhere where we have tight junctions, like the bladder, with recurrent types of problems, or in the kidney. And so much of what we see in terms of pathology is related to tight junctions and leaking of some of these uh, irritating substances that are destructive to our cellular components, and then to the ability to wall off those particular areas and prevent some of these larger molecules from getting into the sensitive cell area, and leading to disease, and metabolism. So, we've got receptors right in the mitochondria, and so there's a regulation of the mitochondria in terms of the energy output, as well as a shift in the type of metabolism that's going on within the cell, away from glycolysis and more towards an oxidative phosphorylation. And so that's an improvement in energy function that's going on. Well, I've hit upon a lot of subject areas, but I want to use some examples that in my case studies that I've experienced for my patients. And I've got a few more that I add onto here as some gravy to the topic to give you some ideas about the breadth of clinical applications that CBD can have. Now, I realize that the only one that is registered with the FDA is epilepsy, and that's for a commercial product, that pharmaceutical product, Epidiolex. But we might be able to compare and contrast Epidiolex perhaps in the question and answer period. But I'm going to cover these particular areas and a couple more to give you an idea of my experience and working with CBD for a broad range of clinical type of problems. I, I really like to bring up this one as the first line, where I worked with a 61-year-old woman with Down syndrome, and she had trisomy, and she had a mild impairment from birth, and she was cognitively impaired to a certain degree, but there was a rapid decline into dementia over a year and a half, going from 2014 to 2016. And she stopped talking and eating, and she showed violent, aggressive behavior to her sister. But a topical application of CBD was very effective at reversing dementia within 3 weeks. It brought her back to normal, essentially, normal eating, normal activity, normal behavior, and it was a dramatic transformation. And I used it orally, I used it topically because she wasn't eating at the time, so she was refusing food. Hop soil is a derivation of caryophyllene. I've found there's a significant amount of information about caryophyllene as being a valuable cannabinoid receptor agonist. And so I included that in this particular case, but I don't always include that And, for all of dementia, I've got about 75% of people do respond to using CBD. Why does it work on the body? Why does it work on dementia? Well, there is a broad range of different changes that occur as a result of CBD on the brain, on any effects of the brain. So you have an upregulation primarily of the endocannabinoid system. You've got neuromodulation that's occurring. It's adjusting for those neurotransmitters away from the excitotoxicity that can occur from rapid release. Immune regulation, where you have inflammatory phenomena, glial cells that are in inflammatory mode, you're going to stop that particular process. Vascular support in the area of leaky membranes. So often in many of the diseases that we encounter, even for neurodegenerative conditions, we're having leaking of large molecules into the brain area and inflammatory molecules, even cytokines, that are worsening a situation in the brain and creating oxidative stress on the body and on the brain and on nerve cells that are invoking a number of destructive actions within the brain. Mitochondrial support. I think we're getting more information about there being a deficiency in mitochondria that are occurring in a number of these particular neurodegenerative conditions. And mitochondrial support is fascinating in and of itself. And the other area I'm going to touch on a little bit more is neurogenesis, actually stimulating the formation of more nerves. So right within the mitochondria, CBD has cellular effects. It actually shifts the metabolism of the cell and preserves glutathione, and it reduces the amount of reactive oxygen species that are circulating in the cytoplasm. But in the mitochondria, it's decreasing a few of the complexes. It's shifting the cell to our pentose phosphate shunt, which is actually rather than a destructive phenomenon, it actually creating additional molecules such as the glutathione, and it's burning up extra glucose. And so where there is, it's been termed insulin diabetes type 3 for dementia. By shifting into the pentose phosphate shunt, it's using up that glucose in a constructive way and generating energy, more efficient energy than the glycolytic cycle. It's increasing the energy output for the brain, and it's actually stimulating the formation of new mitochondria. But probably the key one here is that it's preventing cell death. Now, here's one of the paradoxes for CBD, that we actually see that for uh, most cells and CBD and normal cells, CBD is actually protective on those normal cells and prevents cell death. But in cancer cells and certain types of unnecessary inflammatory macrophage cells, it actually stimulates apoptosis. So a self-suicide of those particular cell systems when we no longer need them, or we're trying to eliminate them from the body. So an interesting contrast and a paradox. And there's other paradoxes for CBD, and I hope we'll talk about those other. And then neurogenesis, where we've got this such a fascinating area where we're actually stimulating stem cell neurogenesis. Now, if you've looked at any of the literature, you've done any reviews, you recognize that depression may have a lot to do with some of the loss for that stem cell functionality. And in fact, there's a chronic inflammatory situation in the brain. And by stimulating stem cells, then we're actually producing a calming reaction that's occurring in the brain. But it's also increasing the number of axons, the number of synaptic proteins that are present, and dendrites as well. And it's reducing the amount of gliosis, which is the scarring sort of response from inflammatory cells that are in the brain and resident there. Um, and we also know that it's the neurogenesis. It's actually creating more nerve cells based on the stimulation by the PPAR gamma stimulator on the receptors within the brain. So a broad range of effects on the brain and for neurodegenerative conditions that can bolster any particular therapy that we have for the brain. I just want to take one step back and tell you that my approach is that CBD is not the solution for all problems, but that it is an adjunct to the therapies that we already know: the diet, the exercise, the proper sleep, the hydration, the nutrition. All of those things are essential. And when it comes to cancer therapy, as an adjunct to chemo and radiation therapy. So in addition to, as a complement of, rather than as a sole source and solution for any particular problem. And does CBD work in all cases? Oh, definitely not. There's something missing there where we have missing elements in nutrition. CBD is not going to work completely. In fact, we've got information that says that omega-3 deficiency will absolutely paralyze CBD therapy. So that's something to consider in your therapeutic approach for different patients. Now, here's another patient I have that's locally in Vancouver, a quadriplegic, a gentleman who fell from the second floor some 5 years ago. And he's had a brain injury, some PTSD, um, and depression. But the major problem that he was having in his rehabilitation facility was his muscle spasms that were absolutely devastating to him and required very, very high levels of opioid therapy, which nauseated him, blocked his gut, and interfered with his consciousness. And so, since starting CBD with the first dose, his just a dramatic response with spasms being relieved, his depression lifting, and he saw progress in improvement on some decubitus ulcers that he was developing, as well as his overall sleeping and his behavior and his interaction with staff. So he's making significant improvements. No, he hasn't been restored from quadriplegia, but his life is so much better as a result of using CBD. When we talk about pain, as you well know, that pain is multifactorial. It's not a matter of, gee, I've got this uh, nagging pain right here in my ankle or my wrist, and it's giving me a lot of problems. So let's just fix that and the problem solved. By no means, no. We have a plethora of different types of issues that are involved with chronic pain. And so if we're thinking that using a drug to take away the pain is going to solve all the problems, we know that that's not a solution. But here's where CBD comes in that it addresses many of these chronic problems as oh, by the way, and as an additional benefit of using CBD, so that you're really getting the ideal approach for a chronic pain situation by addressing all those problems, whether it's depression, anxiety, frustration, spasm, mobility issues, cognitive impairment, sleep disruption. All of these things are helped by CBD. So although you may not be able to provide 100% analgesia using CBD, you're correcting for a lot of the chronic pain irritants that really lead to a great deal of suffering for chronic pain patients. So one of my areas, being a military veteran and combat veteran myself, is seeing soldiers with post-traumatic stress disorders. And this gentleman, 34 years old, he was a medic in Afghanistan, and he was close by when a mortar hit. He had a concussive type of injury. There's no obvious injuries to him, but he started having major problems with his mood, with his functionality. Listening to him at one of my YouTube videos that you can hear, he was just destroyed by this. He certainly couldn't work. He couldn't function at all. But yet after a week of using CBD, his mood improved, his anxiety resolved. He was planning to get back to work. And that's one of the hallmark features that I see with CBD is people get back onto their their activities again. They want to get back to work and become really functional within their work area, and they develop a passion for doing things that are really valuable, as well as some other side benefits that I'll talk about a little later. So the interesting thing about using this, and it's been confirmed in some other the other anxiety related disorders, is CBD not only corrects for these symptoms immediately and with a sort of initial therapy to change the environment and the functionality of the brain, probably by upregulating the endocannabinoid system, but it's also leading to remissions in many cases. Perhaps as many as 30% of these patients actually go into remission, so that they no longer have to take CBD in order to maintain their health, and they can use it intermittently or to optimize their performance. So a nice feature. And the other point I need to make about PTSD is, sure, we're focused on the veterans, but my goodness, we're really overlooking the major population that are involved with post-traumatic stress disorders, and that's women who have been abused or neglected, or childhood neglect. These all potentiate people for post-traumatic stress disorder, and the military only represents about 30% of the total population of post-traumatic stress disorder. And so although they may not qualify for the technical definition of post-traumatic stress disorder, in fact, this is a spectrum, and you should consider that in many of the people who are anxious or who have perhaps traumatic and stress type of related problems in their life, and or have a background of abuse or neglect. How does CBD do this? It's really quite impressive, and we've got very good studies to show that it reduces acute fear. It blocks reconsolidation. That's that portion where we replay the same tape over and over again, and it blocks that replaying of that tape. It enhances extinction. You know, if we have a bad memory, CBD can block that particular, well, excuse me. So we can forget those bad memories, but what happens in PTSD is that link is broken, and so we can't extinguish it. We can't get rid of it, and CBD facilitates that, and it restores the endocannabinoid system, and it rebalances the hormones for the cortisol system. So it's regulating those hormones and normalizing the cortisol, and eliminating that fight or flight phenomena that is so prevalent in these particular veterans. Now, this is a really gross picture of a wide excision on a shin of a young man, 45-year-old. I say young because I'm 69, so it's got to be young if he's he's over 20 years younger than I am. So um, wide excision for a malignant melanoma, and they weren't able to get a skin graft on this because he had signs of infection. They delayed it and they delayed it. And we started using CBD orally on this, and within a week we saw immediate pain relief for it. The infection resolved quite rapidly, and this is all oral. It's not using it in any topical formation, and the infection resolved. We started to have rapid closure, so rapid that the decision was made by the patient to discontinue the request for skin graft because he was closing at 1 centimeter per week, and the skin graft really couldn't be achieved in the amount of time that would allow that compared with the healing on this particular approach, and the relief of pain and the ability to get back to activity. Not only that, that when the wound was finally closed, there was no significant scarring formation as a result of it. So a soft and pliable wound with rapid recovery without any significant pain, as well as helping him with those other side benefits that I'll mention later. What kind of action was CBD doing? Well, it's got that vascular action that controls the leakage of those particular membranes and those inflammatory cells. that would normally pour into an area of injury. It's reducing the immune reactivity for the area where you have macrophages going in and creating an inflammatory situation, preventing cell damage, reducing fibrosis, and helping with the um, other symptoms that we have in the endocannabinoid, the pain, hunger, stress sort of reactions that people are experiencing when they've had an injury and they have chronic pain. But a number of other features that are going on within the wound that are highly beneficial for rapid healing. And lung cancer. An 87-year-old man with stage 4 lung cancer undergoing chemo and radiation therapy. CBD was used in support and enhancement. It actually enhances the killing effect for the chemo and radiation. And it protects the normal tissues from damage so that you're not getting the chemo brain and the damage to the liver or the heart from many of these chemotherapies, and it's improving the outcome for oncologists who are treating their patients who are using CBD. Now, many of the oncologists are not yet supportive of using CBD, but I think more and more they're seeing the outcomes for patients who insist on using it or clandestinely are using CBD and getting these kinds of outcomes without any significant adverse effects with what's going on. So the patients go through their chemo and radiation, and oftentimes in the work that I've done with patients that have been in a program that I've been working with, they have been able to skip doses of chemo and radiation recommended by the oncologist with their agreement because they had responded so well to their previous treatments. So that indicates to me that CBD is working as part of that enhancement at the same time. Now, I want to mention some other areas that I'm exploring. I'm looking at what I call orphan diseases, diseases for which we do not have a cure at the present time, even conditions that are genetic in basis. Now, who would have thought that children with cystic fibrosis would respond to CBD? But if you look down, if you look at the mechanisms that are involved with CBD, you see there is a potential. And in fact, what I'm seeing there with this 3 and 5-year-old with chronic airway infections and irritability and a growth profile well below 5% for their age is just a dramatic change with a modest dose using a liposomal form, 7 milligrams twice daily, no infections, normal lung function, and they've jumped above their 10% growth profile by height and weight. So that's, they've jumped 2 profiles in 3 months, and so they're growing again. They're interactive with their family. They're not missing school. They're learning. And so all of these, they've normalized essentially by doing this. What other kinds of diseases can we approach using CBD? In fact, there's a suggestion that we might be able to use this in Down syndrome. Down syndrome and preventing the the severity of the cognitive impairment for Down syndrome. One of the articles that I reviewed. What about autoimmune disorders like psoriasis? Yes, CBD with its effect, and I think this is one of the highlights of CBD, is its ability to work and temper the immune system and regulate the immunoreaction. So here's a young woman who had chronic psoriasis with systemic pain. She was using methotrexate, and that was complicated with infections. We found that 60 milligrams resolved her rash, and she had, and all of her other symptoms over a period of 3 months. Now, she still does have a few residual rash areas, but her life has changed dramatically. And, oh, by the way, as a voice instructor, she's actually improved her voice quality as a connection with using CBD. And that's a consistent quality that I have heard from other patients as well. For autoimmune conditions and for psoriasis in particular, it's a disorder of the dendritic cells, and these are some immune modulator cells that are within the skin. And it's using an interleukin 17 mechanism as part of the pathology. There are abnormal macrophages and T regulator cells that are being activated, and you've got increases in the cytokines, the TNF alpha, the interleukin 1, 6, 22, 36, and there's a defect in the T regulators with respect, and the interleukin 10, which is your anti-inflammatory cytokines. Now, this is something that CBD addresses almost all of these problems with an increase in the anti-inflammatory cytokines IL-4 and IL-10 in this particular area of the body. It decreases the number of macrophages, and it normalizes the body's immune function so that it's not prone towards infection. And in an example that was done with bone marrow transplant, the patients who received CBD had less complications and fewer immune reactions, graft versus host reactions, but no increase in infection as a result of using CBD as a modulator of the immune system in a very smart way. What about sleep? Some dramatic effects with sleep. And I tell you, I wouldn't be able to do international travel if I didn't have CBD on hand to help me to increase my amount of deep sleep and increase my sleep duration, change my circadian cycle. Now, this is very, very important because when we go from different time zones, how do we adjust? Typically, the guideline is if you go one time zone, then you're going to take a day to adjust. Using CBD, you can go 12 time zones and you can adjust within 12 hours. And I've done that, and my colleagues have done that very successfully. So, wonderful effect. If you take a sleeping pill in the morning, you feel groggy, you're confused, you may have forgotten what you've been doing as a result of that. But with CBD, you actually wake up with an alertness, an enhancement, and an ability to get going right away and take care of business. It does this at least in part by controlling some of the REM anxiety cycle that we have during our sleep. And I've shown a sleep application that demonstrates this very high amount of deep sleep that is allowed by CBD that really helps with that recovery phase that we need to have. What about performance? Now, this is an area that we don't have really good science information, but this is based on my experience working with athletes and finding out what's going on. And of course, you're seeing the use of CBD for Olympic athletes. You're seeing it for different sports such as martial arts, hockey. Football players are insisting on being able to use this. And frankly, it's going to come into many different areas. But what you're not hearing, the fact is that it actually increases the performance at all level. Certainly, you've got a increase in pain tolerance, so you're better able to manage the pain that you might be experiencing, as well as reducing the stresses as a result of lactic acid. So you're actually able to exercise harder and longer without slowing down. It's changing the metabolism, it's changing the lipolysis so that you're having much greater improvements and more efficiency about using fat that's on the body. It's changing the mitochondria and actually increasing those. It's increasing the cognitive focus. So you're focusing on your particular task, on your sport, and performing better. It's actually improving your reaction time. I mean, in competitive sports, that's so important to be able to react quicker and be able to respond quicker to a ball coming at you or somebody coming to challenging you or a punch coming towards you as well. it improves visual acuity. It actually has an enhancement that occurs with it. And I think probably the major point that is being talked about is the recovery and the improved healing rates. Just as we saw with that large wound, CBD is actually facilitating an improvement and rapid healing for those areas. And athletes have told me that after really extended exercise, where normally they'd be ill for 3 or 4 days, perhaps after a marathon, they've been able to recover in 24 hours and then carry on, even go on to do additional running the following day. And it doesn't require a high dose. A mere tincture of 30 milligrams per day can be sufficient for many of the athletes. So how do you use this stuff? I mean, what's the possibilities, and what formulation do you use? Well, frankly, there's so many different products out there, and deciding what the right dose is really confusing. Plus, every single patient is different. So I just have people start with a standard serving that's on the bottle, or whether it's tincture or Xpan or liposomes, whatever's on the bottle, start with that. Just one serving, and then I'd like to have them use that twice a day, but adjust from there and adjust rapidly. You don't have to wait long. In fact, generally, I have people adjust it right away. If they don't respond within 5 minutes of holding it in their mouth, then I ask them to take a second dose. But I only have to do that in maybe 20 or 30% of patients. Most of the time they respond quickly with it. So you make adjustments in the servings. I either double it or cut it in half. Now the serving size is what I recommend for age 7 to 70, but if you're outside those ranges, just make it a half a serving and start from that point. Because CBD doesn't have any significant side effects, you really don't have anything to worry about in terms of problems with anybody getting sick or ill, or really drug interactions. I'll mention that in a moment. CBD is available in several formulations. I really like the patients to decide what is their lifestyle, what fits best into their lifestyle, rather than saying one formulation is particularly good or is going to be particularly beneficial for them. There are a couple exceptions to that, and one factor is if they want immediate effects, then taking it in the mouth and holding it in the mouth for a couple minutes gives you immediate effects from using that. And if you take a capsule, there's a 90-minute delay, but then you may have a longer duration of action for those people who are going to work for 12 hours or school for 12 hours and just can't be bothered by using CBD during that particular time. And then there's one caveat. The Elixinol products right now have a small amount of THC, but we actually do see people coming up positive on their urine drug screens at 50 nanograms. So even though there isn't any significant amount of THC, people who are being tested are at risk for coming up positive, and we don't want to put them at risk for losing their jobs or their livelihood, or getting into trouble as a result of a positive test. I think the major problem is the drug testing has been set too low. It's been a zero tolerance policy, which is absurd, and we need to make adjustments in that, but that's going to take some particular time. What can you do? I mean, I may have, at another talk, we can have some suggestions about how you can stimulate the endocannabinoid system without using phytocannabinoids. And it's not necessarily, it may not be entirely the amount of THC that's in a product. It may have to do with the metabolism of the individual who's involved. Now, there's two types of treatment. We have the acute phase where you want to use an effective dose for a period of time, but then after about 30 to 60 days, you actually see a decrease in tolerance. And what I mean is that they actually can decrease the dose and maintain that level of fitness. So the CBD is not going to be required. We're not just replacing CBD with another drug, that we're actually seeing a healing process take place, a rebalancing of the endocannabinoid system, I hope, and then an overall improvement so that less CBD is needed over time. What about the bad effects? I've listed a couple things down here that I've seen with CBD, and there's some other exceptions there, but these are the major problems: the tiredness, a mild headache, maybe a lightheadedness, and the statement that I hear occasionally is, "Oh, I feel strange." Um, but are you impaired in any way? Well, no, I'm not impaired, but I just feel different. Okay, well, that's all right, but it hasn't been anything serious that's been a problem. So no tolerance or addiction, no toxicity. The rare adverse reactions. I've never seen an allergic reaction to CBD. Some people will report some skin problems or irritability related to some of the other products that may um, substances that may be in the product. For instance, liposomes with a citrus flavor, they don't like the citrus flavor, or the stevia gives them some irritability and they don't particularly like that. So those are the reactions that I see. No drug interactions. And I really want to emphasize this. The drug interactions that are being reported are actually being reported for isolates using very, very high doses. Epidiolex is designed and recommended at 10 milligrams per kilogram. The doses of CBD that I'm recommending for you are zero point 0.2 milligrams per kilogram. That's the standard dose. And I really don't see the need for going anywhere close to um, over 1 or 2 milligrams per kilogram versus 10 milligrams per kilogram, where they're seeing these drug interactions. At the same time, we're not seeing any coagulation effects. So if they're on warfarin or if they're on Coumadin, there's there's a lot of concern about that, but I've not seen any particular reactions. Besides, if someone's on Coumadin and they start a new food product, then they need to get tested anyway. So just it's a routine testing to see if there are any particular changes. One study I saw reported so that 5 milligrams per kilogram caused some change in the INR for some patients who were on Coumadin. This is an area where I think you all can focus very nicely to look at the immediate effects of using CBD. These are the things that you can see in your patients and will give you a clear indication that something positive is going on, that these patients are getting the effects of CBD and they're making a transformation. The vision, the voice, the facial muscles relax in an expression. Our facial muscles are involuntary for the most part in their particular function. And so we show stress, we show anxiety, we show frustration as a reflex, and we don't control those. CBD relaxes all those things. And invariably, we get a smile, we get an uplifted mood at the same time. There's a deeper breathing, there's a cognitive clarity, there's a memory and tasks. The joints actually increase in range of motion. So for you massage therapists, you can actually measure a change in the joint range of motion by 15 or 20 degrees. And there's an immediate relief of fatigue and pain symptoms. Now, I'm not saying that all the pain's going away immediately. In fact, some patients will hold on to that pain and they won't let it go. Oh no, I'm still feeling pain. Perhaps you can get a gauge for what that pain level is and also look at their other behaviors to go on it. These are changes that you can see, you can measure, and in fact, you can use these as parameters in order to assess your patients as time goes on, as they come into the office. What to look for in a quality CBD? Well, I've listed off a number of features here that you're looking for. And working with Elixinol for the last 5 years, I've seen all of these characteristics, improving the ability to provide that clinical support and answer questions that you have and deliver some presentations like this to help you with some guidance on what to do about different situations. So I really want to open up it for questions. I've listed some links for some references. I've got over 40 lectures and testimonials on YouTube to let you know how people are doing with CBD. You're welcome to take a look at those and let me answer any of those questions that you have. It's been a real opportunity in talking with you about this particular subject.
I've got about 100 questions.
So no questions?
Blair, is there any evidence of it working on people with organ transplants and improving as far as them lowering their doses for, you know, the anti-rejection?
So we do, there's a study, a particular study that was done, I believe it was in Brazil, that was a bone marrow transplant. And so that was documented some years ago. There was, I've got that citation. Now you're asking for the citation, you're looking for that specifically? Was then I think you need to use PubMed, and you need to go to look at CBD, cannabidiol, and you look at bone marrow transplant, and I think you can find that particular article. It should be, and if you have difficulty, I'd be glad to relate to that. Now, your other question was?
Well, I was just wondering if you had any experience with that yourself with your patients.
No, I haven't had any experience with bone marrow transplant patients. Well, wait, I work with a disease management team, and we have one client who's had a bone marrow transplant, and the patient did well and had a good recovery, but I can't be specific, and use CBD for as part of his recovery, but I can't name the particular benefits that were involved with that, except that he did not have the symptoms and discomforts that would have normally occurred.
I have a question real quick about maybe some evidence that's been out there about maybe linkage that people who maybe have family histories of bipolar, schizophrenia, and the possibility of THC exacerbating psychosis. Does CBD have an opposite effect, or because like I've seen studies about treatments for people with schizophrenia with high doses of CBD, and I'm just wondering if those two have opposite effects, and if you have any information, maybe even about the THC and links to psychosis.
Yeah, THC is actually a down regulator of the endocannabinoid system. So using THC actually causes greater problems with endocannabinoid dysfunction. And we know that there is a subset of individuals who are particularly susceptible to psychosis when they're exposed to THC. So these are the people you need to, who should not be using THC and exposure. Yeah, CBD has the opposite effects. Of course, it's an upregulator of the endocannabinoid system, so it's rebalancing those effects, and it does not have any potentiation of psychosis. And you're exactly right. There was an article that was published where there was a head-to-head comparison using CBD in psychosis, and they found that CBD using 800 milligrams per day at that starting dose was as effective as the best of the antipsychotics. But CBD did not have any side effects, whereas the antipsychotics, what we're learning is that they can actually lead to dementia in later years. So wrong direction to go in with antipsychotics. CBD is a great direction to go in. They were using isolate CBD, so they needed to use vast amounts of CBD in order to get those benefits. If you use a full spectrum type of CBD or a broad spectrum with very, very low amounts of THC, then you're going to get the benefits of the entourage. The other flavonoids, polyphenols that are present, and the other cannabinoids at low levels that have an enhancing effect on CBD's effects on the body, with a minimizing of any of the adverse effects. Many of the adverse effects that we see with that could occur with different substances are ameliorated by having an entourage that balances out those particular adversities. And I think that's one of the reasons why we have an enhanced effectiveness at a lesser dose, the 0.2 milligram per kilogram versus the 10 milligram per kilogram. What I find for epilepsy is that about 1 to 2 milligrams per kilogram is an effective dose, whereas Epidiolex starts at 10 milligrams, and the average effective dose is 20 milligrams. So 1/10 of the dosage if you're going from isolate to full spectrum, like Elixinol is providing.
Can I ask a question? Can you hear me?
Yes.
Okay, so my question would be, because I've always been confused because sometimes it's been a little pyramid scheming and, a fix-all, cure-all for everything, and so it's really hard to know how to recommend it. But from what I heard from you, it sounds fairly clear about, for whatever particular thing if the patient has a question from a provider perspective. I'm just reiterating what you said, since there's just to see if this is what you would recommend. You're saying 1 serving 2 times a day, kind of for anyone. Like this whole room could basically take, whether they're sick or not, they like to check it out, or whether they actually have a chronic condition that's related to what you mentioned. You say 1 serving 2 times a day, oral, lingual, or topical, and then you're basically saying try it for 30 to 60 days, whether you're sort of in crisis with something, sick, or whether you're a healthy, decently functioning person. Try it for 30 to 60 days. You can up dose it if you're not really having any effects. Up your dose a bit and just keep upping until you see that you have effect, and then reduce. And my question is, what is that reduction? So you're saying, you reduce over another 2 months, reduce over another 3 months, you stay at sort of a maintenance level. I've just never known how to use it. So that's kind of it for my own self, for example, not even just for a patient. And my question is, I appreciated that clear recommendation, and also milligrams that we're looking for in a product. You say that 0.2 per kilogram is a recommendation, but my question is in a product, in a tincture, in a container, how many milligrams per milliliter is sort of the general recommendation there. So sorry, there's a host of questions there.
Right, you got a lot of questions there. Let me just hit the last one. There's such a variation in terms of milligrams per milliliter that it gets really confusing about what is the right concentration. Generally you can use any concentration, you just have to use more quantity of it in order to deliver the amount that you're trying to achieve. But because of the variability of the products that are on the market, it's just going with a serving size that's there, having people adjust it to their need. Whatever they have in front of them, you can use to help control symptoms. Now, my target is to control the symptoms that somebody has. Whatever they're suffering with, approach it from that point and try to achieve control. Now, if you're well and healthy and you're not having any particular issues, I'm not recommending CBD. Then you don't need to use that. Good health doesn't require using CBD, but if you have a complaint and you have a problem, then CBD may offer a solution for controlling some of those symptoms.
What about sort of like PMS or people just having like anxiety or fatigue or just sort of those general conditions that would be considered sort of a condition that you may want to try CBD for 2 months and see if it works?
Yeah, so the duration is, you're going to get a rapid response. Now, what I usually do is say, okay, what's your symptom? Let's say PMS. Well, let's go through a cycle with you and find out how you do with that. I'm not asking people to use 3 months of it. I find that you will know very quickly how people are going to respond. Just 1 cycle if it's working and if they're using a right amount of dose. The problem that I see sometimes though is somebody starts on, they will get the least expensive product and they'll use the smallest amount that's there. And instead of using a dropper, they'll use a single drop. They don't get any benefit and said, hey, this doesn't work. And then you just have to be careful that people are using a right amount or adjusting the serving size to meet their particular needs, at least giving it a good try to see if they can get control of their symptoms. And then just one particular cycle area of for instance, the PMS, to see if they can control that area and they're using the right dosage. And then if it's not going to work, okay, it's not going to be working with them. But they may find that there are other benefits, and you need to know what those other benefits are there for, so that you'll be able to point those things out to them if patients really are changing. Now, sometimes patients don't recognize the positive changes that are occurring with them, and it takes their family member to say, oh, listen, you are really making some major changes. Cute story, I had one husband who would meet his wife at the door when she came home from work, because she didn't feel like she was getting any benefit from it, but boy, that husband saw the benefit and made sure that she was getting that dose when she came in after working all day. So it can be subtle in certain personalities that they don't recognize and they won't appreciate the changes. And so that's why you need to be able to watch the patient, see the changes, and monitor with the family to see if they're actually noting some of the changes that some patients will deny.
Has really from using CBD, they're probably, I mean, I could see them not really wanting to come off after a couple of months if they have positive results. So what's that discussion? It sounded like you feel that maybe there's a healing effect from using CBD. So you think someone can be on for a small amount of period, and then they can feel encouraged that, hey, you can try to not use your CBD and see if it indeed had a healing effect to your system, or what's that discussion?
Well, that's an interesting point too, and I've got a video testimony by Amy. I was actually one of the salespeople that's worked with Elixinol, and she started using CBD, and she said, this isn't really working for me, and I'm not feeling anything from it. I don't get any benefit from it. So she used it for a few weeks, and then she stopped it, and then she felt a gradual decline in her performance and her functionality, and started having many symptoms come back that she hadn't realized had gone away. And then only at that point, after withdrawing or stopping using CBD, did she really notice the positive changes that had been occurring with it. So some people just don't notice those particular subtle changes. When you go from going to normal, doesn't seem like a big deal for most of us, but if you're in the depths of depression and pain and anxiety, coming up to normal can be a big deal. However, it can be very, very subtle, and I think that's one of the reasons why CBD is forgettable. People will forget to take their CBD when you would think this is a no-brainer. It's really working for your migraine headaches and your other problems. Why did you stop using it? And they just, I forgot. and so that's another indication of the lack of tolerance that goes along with it, and the lack of addictive qualities. There's no craving for using CBD. It just can be an enhancer for our overall performance rather than being an addictive substance that we have to maintain. And then stopping CBD, the only thing that people say about it is, oh yeah, my symptoms start to come back. It's not that you have like with an opioid, where you stop the opioid and the pain comes back with a vengeance. Instead, it's more subtle. The symptoms come back fairly slow. In one of my patients with dementia, she forgot her CBD. She had dementia, and she recovered dramatically after using for about 4 weeks. And then, oh, by the way, she went on a safari to Africa, and she forgot her CBD. Well, the whole time she was in safari, she had no problems. Family members reported she was fine. But when she came back after 3 weeks, she really started to crash and burn, and they got her back on her CBD, but only at that point. So the way I theorize it, and we don't have the evidence yet, is that you have that enhancement of the endocannabinoid system, you have that rebalancing that's occurring, and so you don't require continuing drug levels like with an anti-epileptic all the time. You've actually changed the environment of the body and improved the overall health, so that there's a slow deterioration over time as the CBD gets out of your system.
I just want to share, I'm going to move the camera back a little bit, just share the group, my own experience, and for some of the nurse practitioners and stuff that came today, but I definitely don't crave it. I do forget completely, and I take drug holidays. I don't do it for 48 hours and something like that, and I just kind of notice a gradual creeping back of things that might be like anxiety. That's the thing I'm mostly trying to treat with this, and it's extraordinary to note that and it doesn't take a lot to just kind of get back out of the anxious zone with just minimal treatment. And again, I really think about it like just, if you, like when you take Advil, when you take supplements, you don't feel anything. I don't feel anything. Like I don't go, oh, there's nothing, there's no, overtaking feeling. I'm just, moving through my day and things are going well, joints are moving, so on and so forth. I used to, treat myself with Advil, and I don't do that anymore. All the chronic injuries from ski racing, I mean, that was bad. This last 2 years ago teaching, I was struggling walking around the hallways, and I don't even think about how I just go up and down stairs now. I'm like, oh wait, it's just weird. And I actually realized I'm taking much more than you're recommending too. I realized that I've been taking about 40 to 50 milligrams twice a day.
But you did recommend the high for the athlete
Yeah.
or we'd have to use that.
But I think he said 30 milligrams per day. I think I'm taking 80 a day. But I might just based on what you're saying today, I might just try to come back off a little bit, just see what happens. But I do notice that I just fall asleep. That's the thing I didn't used to do. And the question I guess I had for you was I read a study as well about functional MRI studies on Oxford University students that were showing like massive decreased brain activity in the amygdala for kids for college students who are suffering from stress and anxiety, and those treated. And that's what I would notice is I just don't have the fight or flight feeling that kind of goes with generalized anxiety. It's just gone. And that's like I'm just moving through my day thing, but I don't feel any different like central functioning or clarity. All those things are fine. I just don't feel that bubble, that like, oh shit, something could go wrong. I don't know if that's true if you're hearing about amygdala, if it's affecting that fight or flight or studies on that you've heard about, but I'm curious.
Yeah, all preclinical studies are pretty clear about the reduction in the fight or flight phenomena. In fact, several people have, someone yesterday came to me and said, I realize now that during the last 6 months that I've been using CBD, that I'm handling stresses a lot better. And so we kind of listed off, she's looking at a divorce. Her kids are teenagers and thinking about being disruptive behavior. She decided to go and start on her PhD. She's dealing with an independent woman who is running her own business and doing entrepreneur activities and becoming president of the local chapter of the Holistic Chamber of Commerce. And she says, I don't think I would have been able to do that without having CBD on board to be able to keep my anxiety levels now and keep me focused on the next project. I really feel capable of working on these areas, and I would interpret that as reaching your full potential, not doing anything that you would not be able to do exclusively, but to be able to just be at your best performance for whatever it is that you do.
I'm going to steal one more question, and then I'm going to throw it back at other people here. But the thing I was thinking about was, I thought this was important because this is the first event we've had here where we've had a lot of healthcare practitioners walk in. And I saw a recent study that said that of the poll of practicing MDs in the United States, said that like less than 9% of them know anything about the endocannabinoid system. It didn't say they didn't acknowledge it existed because they are aware it exists, but they knew virtually nothing about it. Less than 9% of the existing MDs. That's like MDs not acknowledging or doing anything to learn about the digestive system. I think it's like absurd that they don't know it. And then they said of existing interns in American med school programs, only 15% had done any studying of the endocannabinoid system. So I do think that I share the skepticism because we don't know, and the prohibition against cannabis and the cultural prejudice has led us to a place where we haven't done enough studies about it. Everything's happening in the UK or Israel, but it's not happening here. And we do have doctors come in and are curious and asking questions, but it again, it feels like another fad or another phenomenon. And I don't think there's a question right here, but I just want to point that out. It doesn't seem like
Well, you're right. There's a lack of awareness. There was a study done in 2013 that said that 13% of medical schools were saying something about the endocannabinoid system at that time. The awareness of physicians is increasing, but they still are categorizing it as marijuana. Like, I don't want to have anything to do with that. And the clarity on the regulatory and the FDA is all very confusing. Can I say anything about CBD, or can I say anything about cannabis when I talk to patients? Am I liable? All this stuff needs to be sorted out, and there's a fairly slow trickle down for that. But if you look at the literature, it is replete with large numbers of studies that are quite informative about this system and how it's interacting within the body. And if you follow these connections, which I have the time and I have the interest, I want to dig down into these details so that I'm tracking on them and I'm seeing connections to almost every area. Every one of our major chronic diseases has an endocannabinoid deficiency. In fact, they overlap. So you've got irritable bowel, you've got migraine, headaches, you've got autoimmune diseases, and you've got depression. All these things are actually occurring in many of the same people. And you have to think that, well, is there a primary problem with the endocannabinoid system, or are toxins in our environment or dietary indiscretions leading to these particular phenomena? But I think that we now have a focus of an approach towards treating the endocannabinoid system with these multiple modalities and using some benevolent phytocannabinoids in order to correct this particular problem. So the other area of interest is using omega-3s. And, in my review, it says that we need about 2 grams. Well, I recommend 2 grams of omega-3s. If somebody has a deficiency, they need to have a sufficient amount of omega-3s coming into their body. And if they have one of these illnesses, then I actually have to ask them to supplement to get at least 2 grams a day. And unfortunately, we have a conversion from ALA to only about 5% to omega-3s. So ALA is not always sufficient to getting our omega-3s. So omega-3s are key and important, and of course all the other therapies that we have, but phytocannabinoids may be a way to approach some of these chronic diseases for which we don't have good treatment, and we've got toxic drugs that may otherwise be used, to use CBD in their place.
I have a question. So
Yeah.
I have been wanting to add CBD to massage. Do you recommend an area of treatment, or is a full CBD body massage a positive thing?
Well, CBD topically is immediately effective for an area of pain. And that's a bite, a burn, a trauma, even a viral lesion. CBD applied to the area will give you analgesia within 5 to 10 minutes. So if you are seeking to control a focal area of pain, then CBD topically to that area is great. Now, for some people, there is actually using it topically for a systemic effect is an effective way. Now, some patients don't want to use it. There's resistance to using it, but using it in a systemic way, as I described with my dementia patient, was an effective way to get that into their body. And then other patients have told me that their preferred way when they have generalized aches and pains from fibromyalgia is to use a topical approach. the oral approach, they may feel like they've got excessive dreams and they don't feel at their best. But a topical approach has been very soothing and relaxing and calming. And for people who are normal, who are really looking for relaxation and as a massage to calm things down, then a system-wide and a total body massage with CBD at a low level could be quite valuable, and a special addition to therapies that are being offered.
What do you mean by a low level?
Well, so generally, I'm not thinking of trying to deliver high doses like 80 milligrams that like Jay is taking topically and smothering him with CBD from top to bottom. I'm really thinking on the order of maybe 10 milligrams per milliliter concentration that would be used and distributed, or using one of the balms. The hemp balm is particularly well absorbed, even though it doesn't contain a lot of CBD. It really is facilitated getting into the body and can be easy to incorporate it in a massage type of therapy. Or, one of the issues that happens with you have somebody who's hospitalized, they're in a facility, and those facilities are not going to allow you to administer any drugs. But, oh, by the way, can I give mom a massage? And they say, oh yeah, you can massage your favorite oil in. So you bring in your CBD and you massage your shoulders or you massage an extremity. And lo and behold, she perks up and she's improved in her functionality. And so it's a way that you can address some problems for people who are reasonably sensitive. Then they can get a nice response to using a systemic approach through a topical format.
I noticed that with Elixinol they have a double formula now.
Yes.
Is there one that you would suggest? I know you said milligrams per milliliter. Is it just depending if they're in chronic pain or if they're just wanting like overall relaxation? My nerves are a little jittery. I just want to wind down a little bit.
Yeah, so the hemp balm is an oil based. It's a balm formulation, and it has a little bit of greasiness that's associated with it. Some people don't like that greasiness, but it does have an enhanced absorption to it. Certainly, the basic hemp balm, we've gotten rave reviews on that over time, but then you do have that double strength that maybe that's the type of thing that we would use for a systemic approach, or somebody who needs a little boost in the amount of CBD that's being applied topically. Now, the 300 milligram tincture can be applied topically, and that's 10 milligrams per milliliter. And that's about the concentration that I use for my dementia patient. And that seems to be universally, well received and well tolerated. So that's the oral formula, the oral tincture actually used on a topical basis. And then here's a surprise, is the liposomes can be used topically. And unique to the liposomes is they actually dry. And so after 3 minutes of a topical application, you actually see a drying effect. You don't have to worry about that, getting that onto the clothes or being greasy after that exposure. Now, none of these products are recommended for the face. They can cause some irritation to the eye, but I've actually seen a lot of people who applied it very subtly around the eye, around the face, and avoiding the eye. And it's really quite magnificent for controlling skin rashes as well, including acne.
So both of them are oil-based, but because they are oil-based, they absorb better?
Yes, it seems to traverse the skin very, very well, just as it traverses the mucous membranes very, very well. Now, the technical data says that CBD only goes through the skin at the rate of about 4 or 5%. But the dramatic effects that I've seen says there's something else seems to be going on that indicates these effects are more significant than just looking at the blood levels. So blood levels are not occurring at high levels, what you would expect to be required to provide local analgesia, but in fact, we are getting local analgesia. So it may be that there's another mechanism that we don't understand. Perhaps there is a relay phenomena from CBD being applied to intermediate cells, whether they're fibrocytes or dendritic cells that are signaling an anti-inflammatory response that's leading to cross the fascial planes to get into a joint and provide analgesia. I don't know what that mechanism is, but I can tell you that based on what I've looked at, I've not been satisfied with the explanations there, that they correlate with the clinical impressions that I've seen.
Yeah. Can I ask about cost, pricing between sublingual, topical, just basic information?
So I think I heard you say you were asking about cost for these different approaches. Yeah, so cost is, of course, that's always a factor, is what can the patient sustain and what's going to be cost effective for taking care of different problems. So your highest cost per milligram is your X-Pen. It's a sort of concentrated formulation, but I can tell you that that seems to be a premier product that the salespeople from Elixinol personally prefer, and commonly use. And that's my preference. I think it has a rich balance of the other endocannabinoids and the other flavonoids, so that, but that's top of the line, and that's quite a bit more expensive than the other products. The next is most expensive, I would say, is the capsules, and because they're packaged and the way that they're arranged, and that's a little bit more expensive. Certainly the 45 milligram capsules that are now available are significantly increased in cost. But going from there, and then the standard capsule is 15 milligrams. But probably the most cost-effective approach is using the 3600 tincture. That has got the lowest cost per milligram, and of course, one of the largest amounts, but the total price on it is a bit challenging for people. On the other hand, you've got a 300 milligram tincture that is really cost effective. I mean, it seems like it's a great cost point at $30. Looks like a great deal, but people have to use enough of it to be effective. And so, for the most part, I see that as a sampling, as a paid-for sampler to find out, okay, what's the dose that this patient needs, and they want to start off small, and they're skeptical and they're not sure if it's going to work. Use that 300 milligram tincture at $30, and you may use it up in 5 days, but the point is you're going to find out if it works and if it's going to be effective for the problem that the patient is looking for. And then finally, I see the liposome as being really an all-purpose and a very cost-effective, where you've got a month's supply that is effective for most problems in a single bottle for 60 milligrams. The 1,000 milligram liposome is much more cost-effective, where you get a little over 3 times as much CBD with a 1,000 milligrams, but and that longer duration, of use, 2, maybe even 3 months of use, and at just twice the price on it. So you've got a wide range of different choices that are coming on there, and whatever my strategy, my recommendation for you as practitioners is whatever you can get into the patient to start with, and make adjustments from there. Capitalize on the improvements in their particular symptoms, and encourage patients to use the appropriate amounts to control their symptoms, and then allow patients to cut back from their other medications, as well as from CBD, when they feel like they don't need to use as much and they're getting the benefits that are there.
I'm happy to, after the show, kind of because we don't just have Elixinol products. I just wanted to see the difference in cost and all that stuff. But one thing I was going to mention too is that we also have had some significant luck with suppositories for women with endometriosis as a delivery method, and on people with lower back pain, if they're willing to try that method. So it's really varied what's out there. I mean, companies do try different things as far as like what is effective as far as delivery methods. and we have a transdermal cream by a company called Myoderm that we cannot keep on our shelf. It just flies off the shelf, and just little bottles. People go home and they're like, it's amazing. Like, it's a transdermal cream. It delivers a lot more CBD, and it's an isolate too. That's the thing that surprised us. Is it was non-THC isolate, and people have loved it. So,
Well, I think you are. I think suppositories can be a great way to go for individuals. In the United States, we're not much into suppositories. Europeans and other cultures allow that, and it's acceptable. But for the United States, there's not much in that way. Yes, but CBD can be used as suppositories and can be very, very effective with that particular approach. You can use capsules actually as suppositories. Then the capsule dissolves quite quickly and without any residual, and so that can be a safe approach as well. You know, if you're using it, I did have one patient who was using capsules as a suppository vaginally, and I instructed her to use it every other day, but she insisted on using it daily, and she did get a vaginal irritation from using that. So she found that particular problem, but that wasn't exactly the guidelines. And if anybody encounters any problems, then adjust the dosage to and do things practically and logically, or come back to the provider to brainstorm about maybe a better approach. There are other CBD products that are out there that you can experiment with and to explore, and I think there's some very good ones that are also available. And I think it's very reasonable to consider some of the other products that are there. I mean, it's the consistency that I found with Elixinol and with where the product comes from has led me to rely on that primarily.
I just wanted to, can we just go back to kind of recommendations around dosing for a minute? Because what I heard you say was kind of a standard dose that you might start someone would be 0.2 milligrams per kilogram. And so that would be about 17 milligrams for a 150-pound person per day. But then you said 1 to 2 milligrams versus Epidiolex 10 milligrams per kilogram. So by my calculation, then for a 150-pound person, you'd be talking about a dose range that could start anywhere from 17 milligrams to like 150 milligrams a day, which is what we find with people in our dispensary, is that people, we recommend start low and go slow, but we usually get people up into a 30 to 40 milligrams twice a day range is where we're finding the most range of people. Does that sound what you were saying is the point?
Yeah, it's consistent. What I'm trying to do is respond to demands from practitioners who want to use, and from dispensaries who want to have a milligram per kilogram. They just have to have it because they're thinking in that pharmaceutical mindset that this is a drug and I've got to use it like a drug, and so I got to think like a drug, milligram per kilogram. But this, you know, it really defies all of the mechanisms and the approaches that we have that we've thought of with regard to drugs. And you don't need really a milligram per kilogram. I give that as a range and a target, but then when we're talking about specific conditions, if we're talking about epilepsy or chronic pain, then it's you're going to be adjusting on a target, and that it may be more specific. So particularly for epilepsy, you know, looking at that 1 milligram to 2 milligrams per kilogram, that's a pretty good target area for people to go in, and for milligrams per kilogram, that makes sense. For all of the other areas, there's such a variability in people's response that it's so inconsistent that I prefer to look at servings and making adjustments serving wise, and then monitoring the patient. You know, the clinical feel for what happens. Are you getting relief of your symptoms or not? Or are you feeling fatigued? That means to cut back. And so looking at the response for the patient and how they're doing, rather than keying on a drug level, which is not available, and seeing how they respond. I think it works out better from a clinical standpoint. But the other reference feature I'd have for you is if you get to 200 milligrams per kilo, 200 milligrams total, and people are not responding, then I'm not sure that they are going to respond at all. I've got one patient on a higher dose than 200 milligrams per day, and they're truly the exception. So you get up to the 200 milligram level, and people are not responding. It's unlikely that they're going to respond from this product at that level.
I have another question. For particular acute conditions like sleep, someone having an anxiety attack or someone having trouble tonight going to sleep and things like that. What about using, or someone having a brain fog in the morning because they're menopausal, whatever it may be. What about acute use like that of the day, like a situational use versus sort of the conditions and treating those chronic conditions?
Yeah, so that's you've touched upon a couple different areas and a couple different strategies. Certainly for sleep, it may be better to use it the night before. I don't like people to use CBD within 2 hours of their sleep time because of that paradoxic reaction that occurs with CBD that has a waking effect where we're more alert and we're processing more, and that's actually stimulated people to stay up later and continue awake. And so about 2 hours before sleep. However, there are people who take it right at sleep time, and to people who, if they wake up during the night, they'll also take CBD. An interesting phenomena is that when you go into deep sleep, you do not remember deep sleep. And so I've had people come to me and say, I didn't sleep at all using CBD. And I ask them, are you tired? And they say, well, no, I'm not tired. So you're telling me you didn't sleep at all, but you're not tired. And so I believe it's that deep sleep that people go through. They're actually getting regenerative sleep, and they don't remember that sleep quality that has the sleep time that they've actually had. So for people who are waking up groggy and they're having difficulty getting started, then the night before, about at least 2 hours, or just the day before, consistently people report after they take a daytime dose of CBD that they've slept really well, some of the best sleep that they had. Now, I have to admit that the sleep benefits can be intermittent. It's not a sleeping pill. It won't knock you out, but it just improves that quality of sleep. And so it can wax and wane to some degree that goes on with it. But for other acute situations, then taking an oral dose and holding it in the mouth for a period of time can be extremely beneficial to get an immediate effect within a couple minutes. I've got some testimonials and demonstrations on my YouTube that show how quickly those benefits can be felt, and that's what I like to recommend for that acute situation. If we're feeling starting to drag in the afternoon, the common thing is, hey, I need a cup of coffee to wake me up. Well, use CBD to wake you up. You'll get a lot more done, and you'll have you'll have a nice response. You'll improve the sleep quality, and you'll be nicer to your colleagues than if you became irritable necessarily with a cup of coffee to go along with it. So my point is that we're already using drugs. People are going out for a smoking break to get their nicotine. People are using these substances, and CBD is one of those other things that pick me up to deal with some of the stresses of life that we have to contend with on a daily basis.
What do you suggest for like minimum and maximum sublingual time? Like how long does it take? Like minimum time a minute, but hold it in for like up to 5 minutes, depending on your need, or is there a suggestion you have?
The typical response from holding CBD in the mouth is about 3 minutes. 2 to 3 minutes, you see these particular changes that I described, the facial changes, the relaxation. And if you will ask the patient's questions based on those that I've listed there beforehand to do a self-assessment, including the range of motion of a joint, like turning their head side to side, seeing what that range of motion is, or checking their how far they can bend. And then ask them and check that after 2 or 3 minutes, and to see that increase. And you'll get you may be able to get a buy-in from the patient that, oh yeah, I actually do see a significant improvement in those areas. So typical response is 3 minutes. Some people have a little bit of delayed, and it may take 5 to even 10 minutes for the response. But that's from using it in the mouth. If you take it from an oral dose, then you really going to need to wait about 90 minutes before you're going to see those particular changes. Now, one of the universal hallmarks of CBD is smile and laughter. And so after using CBD, there may be a joke that they'll crack, or there's a chuckle, and the smile that occurs on their face. It's such a nice confirmation that they're feeling the effects of CBD. Often I get the question is, well, this must be placebo. Nothing can act this fast. Well, it turns out that the placebo effect is controlled by the endocannabinoid system. So CBD stimulating the endocannabinoid system may give that particular effect, but consistently patients who report those immediate effects report that they are consistent over time. So it's not just a flash in the pan, it is a consistent effect that they get from CBD over time.
I was going to say, one thing about the placebo effect that's kind of interesting is, even if this is all placebo, like, and I'm just stoked that I'm this good at convincing myself, there's one thing that just blew my mind. Kim said, one morning she said, I had a sore throat. She goes, throw some CBD back there at work the other day. And it wasn't one company. Each time I've had like a little sore throat in the morning, like post-nasal drip or something, it's like instant. I'm like, okay, because I was thinking, maybe it's the olive oil, maybe it's one of the other ingredients in these oils. Unbelievable how fast that cured. And so every time I've had like a post-nasal drip, I don't like putting it in the tongue. I drip it right back in the throat. That's the only thing that I can say was not placebo. I was like, it feels like that stuff you sort of feels exactly like chloroseptic in the way it just eliminates it. It's fun. That's the only one I can say is.
Well, Jay, you made a good point, and is that a lot of the viral symptoms and the cold symptoms that we encounter, we can control those with CBD, whereas otherwise you're using the sprays and some of the nasal agents and different types of gargles and aspirin or Tylenol. CBD can help with a lot of those particular symptoms and reduce the amount of inflammatory reaction, so that we are able to sail through those illnesses much quicker than we otherwise would, and control them very effectively, so that CBD can become that primary agent that is in our medicine cabinet that we can rely on for different types of problems that we encounter.
Any other questions for folks? Did you lose your question?
Oh, I'm good. Yeah, he answered it.
Yeah. Well, thank you very much.